Tosh, are you on mute?
Good morning. My name is Josh Schreiner. I am the Chief Product Officer at HealthEZ. Thank you for attending our exclusive webinar today on precision pricing. We're very excited to talk to you about our newest discount methodology, which is a component of our broader cost containment and cost reduction strategy for self-funded and level-funded employers. Many of you have probably experienced, especially since the COVID pandemic, significant increase in medical claims costs. Not only have we seen the dollars increasing, but we've also seen the volume increasing over the last 4 to 5 years. Here at HealthEZ, we are constantly looking for ways to reduce employer spend while delivering a exceptional member experience. Today, we're going to talk to you for about the next 10 to 15 minutes about our latest product innovation called precision pricing. Many of you may be familiar with solutions like reference-based pricing. The one thing I want to impress upon you today is this is not a reference-based pricing product. This is a refinement of leveraging national PPO networks and carving out a select set of services to really control costs for a plan sponsor. So what's the problem? The problem is that 10% of medical claims are driving 80% of the total plan costs. We continue to see employers gravitating towards traditional PPO network solutions. And some of those network solutions are actually performing very well, getting average discounts anywhere from 50 to 55% off of bill charges. The problem with the discount game is, what are you getting a discount off of? At the end of the day, the way that we need to be measuring plan spend is understanding what the per unit cost is and leveraging some sort of a benchmark such as Medicare to determine whether that average discount is actually good or not. You may have a claimant in one part of the country where the provider is billing 1,000% of Medicare. And you may have another claimant in another part of the country where the provider is billing 300% of Medicare, and both claims get a 50% discount. Which one's better? I think we all know we'd rather have the 300% of Medicare with a 50% discount than 1,000% of Medicare with a 50% discount. And so our focus with this product is to really identify those larger claims and pull them out of your traditional PPO network and leverage a new market-based set of reimbursement. And we'll talk more about what that looks like and how we're able to do that. So, good news. You still can buy a network. So for this product, you will be able to elect a PPO network, a national PPO network that your members will have on their insurance card. It will allow them to gain access to their providers and hospitals that are participating providers. What we will do, and we'll talk more about the types of services, is we will be carving out 8 different service types. And instead of running them through the network, we will be running them through a pricing algorithm that has hundreds of millions of paid claims information from the largest insurance companies in America, and determining what the market-based rate of reimbursement is for that specific provider in that specific market for that specific type of service. So an employer in Texas may have a different rate of reimbursement for that service compared to somebody in Georgia or somebody in Colorado. It's hypersensitive to the specific market that the provider is rendering care in. And the goal of this is that by targeting these high cost claims, we believe that we can reduce medical claims costs, the largest bucket for self-funded employers, by up to 19 percentage points while still having access to a PPO network. So how does it work? We carve out 8 services and we target them for our market-based rate of reimbursement. And By doing that, we get an average effective rate of reimbursement where the discount on those 8 categories of service have a discount of upwards of 70% off of billed charges, which results in an aggregate discount to a plan of in the mid 60s, which is how we are calculating that 19% reduction in medical claims costs by leveraging precision pricing. So, some of the services that we will be targeting are claims that are billed at $5,000 or higher. So, this includes things like hospital stays, hospital-based procedures, same-day surgical center visits, high-cost specialty infusions, post-acute care facilities, in-home medical care, as well as end-stage renal or dialysis claims. So instead of having these claims routed through and priced under a PPO network contract, we will instead be leveraging market-based pricing. And some of the reasons that this is a better strategy for employers over going to a traditional reference-based pricing product with a physician network is that at the end of the day, we are setting a rate of reimbursement that is accepted by these providers from the largest insurance companies in America. And we have, at the end of the day, in the event that we can't get that claim price to stick from the market-based pricing, we always have the ability to revert to the network rate of reimbursement on a one-off. So we can confidently say that your members will never have to pay a balance bill as long as they purchase the precision pricing product, not a traditional reference-based pricing product. So some of the things that you'll get with buying this product from HealthEZ is you will get access to our care advocates that many of you are familiar with that provide a white glove level of service that can also help to assist in the event that a member feels like they're being balanced billed. We also are able to guarantee turnaround times on servicing of any of those situations where a member gets billed for the difference between our market-based price and what the provider believes they should be reimbursed, to have those worked within 48 hours. So we're bringing the white glove advocacy level of service that you've become accustomed to HealthEZ. We've made major staffing investments to have dedicated advocates that will work on nothing but this product for employers that choose to purchase it. So a couple of points just to reiterate here. There is no impact on provider access. So you can elect a broad national-based PPO network. Our care advocacy and navigation team is here to assist in appointment scheduling, helping to find low-cost providers. They're able to assist with individuals who have chronic disease management, as well as any potential billing issues. Now, everybody that is familiar with reference-based pricing is probably going, well, I've done reference-based pricing, and there's usually 2% of claims volume that ends up in a balance bill situation. And what is very different about precision pricing, and is a very key component to understand, is that the categories of service that are billed at $5,000 and above represent less than 10% of the total claims volume. And we anticipate of that 10%, that 2% will be a potential situation where a provider disputes the rate of reimbursement. So when you think about it in aggregate, we're talking about less than 0.5% of all medical claims that we anticipate having a potential situation where a provider looks to bill the member for the difference between their expected and what the market-based rate of reimbursement pays. Now, some of the things that we have to back up the market-based rate of reimbursement is some very specific plan document language that has been vetted, as well as has been shared with carrier partners who will underwrite this product, so that we have the defensible position to the provider that the claim did price using the right rate of reimbursement, and here's how it was calculated. But What we can guarantee, again, to reiterate, is that there will be no situations where a member is responsible for a balance bill. We can say that definitively and confidently with the design of this product. We've also been working with our stop loss partners to ensure that the stop loss treaties allow for settlements that occur after a normal treaty period. So if you have an employer who has purchased a 12/15, one of the conditions for the carriers that we are partnering with is that they will reimburse any claims that we have to settle to the network rate up to 12 months after runout. So if a plan runs January through December and has a 12/15, the carriers have to agree to reimburse through March of the following year if we have to settle. And they also get the reassurance that the settlement is no worse than the network rate they would have paid in a traditional stop loss and PPO network plan. So for employers that are looking to be innovative, are looking to lower their claims costs, and potentially provide better benefits and lower premiums to their employees in this market today, this can be a great way to really give your employees better benefits. So, couple of other things to hit on, and we'll certainly leave some time for questions. But this product, again, can lower both stop loss premiums as well as claims costs by up to 25% when used in comparison to just a standard PPO network. For the claims that we're targeting, the average market-based rate of reimbursement will have a 71% discount. Just to give you some context, these categories of service that we are taking out of the network, on average with large BUCA national PPO networks, the average discount is anywhere between 45 and 50% on those 8 categories of service. So a huge improvement, both to try to help eliminate outlier claims, as well as give the employer significant cost reductions on their medical claims costs. And then lastly, but certainly not least, we have worked with key carrier partners to ensure that there is lower stop loss premiums. So there's a rating credit or decrement set up so that when an employer purchases this product, they will have lower stop loss premiums in comparison to just using a standard PPO network. So we did some back testing of our claims history for the prior 24 months and looked at what would the average aggregate discount be on a PPO network, large BUCA PPO network versus this product with a PPO network. And as you can see, we are confident that we would be able to deliver over 12% better discounts on this solution in comparison to your traditional PPO network. This product is hitting the market today. You can quote it for employers with 7/1 effective dates or renewal dates. If you have an existing group with HealthEZ, please reach out to your account manager. If you have a prospect that you believe this could be a good fit and is looking to try a more innovative cost reduction strategy, please work with your dedicated sales rep at HealthEZ. We need generally about 10 days from receipt of a claims file to be able to do a pre-sale analytics so that we can demonstrate to you based on your employer's claims history, here is how precision pricing would look in comparison to a broad-based PPO network. So we're very excited about this new product, and I'd be happy to answer any questions that you may have.
Hi, Josh. Right now, there's only one question in the chat, and that
Sure.
is, actually, there's another one. They're popping in. Are all HealthEZ preferred stop loss carriers in agreement with this, or only some?
Yep. So please work with your sales and account manager. Right now, we have previewed this and worked with 4 specific carriers. So those 4 specific carriers are Liberty Mutual, Ryan's Specialty, which formerly known as AccuRisk, Cirrus Point, and granular. So those four carriers we have been working with to get the pre-set up rating decrements as well as agreement on meeting the terms and conditions necessary to be a carrier for this product.
And the next question is this also available for the level funding program?
No. So great question. This product is specifically designed for traditional self-funded employers. It will not be available on easy funding, at least not this year.
Will settling claims require going to court in case there is a dispute from the providers? Will members be required to be involved in these situations?
So the great news is that we can confidently say the answer to that is no. At the end of the day, the way that this product is designed is if we cannot settle and we go through the appeals process with a provider and we cannot get the market-based rate of reimbursement to hold, at the end of the day, and this is the key between this and a reference-based pricing product, is we have a secured rate of reimbursement that can be leveraged through a broad-based PPO network contract. That is not the goal. The goal is to pay less than that, but that is why we can definitively say a case will never end up in court.
The next question is, who is the network again, and what logo goes on the card?
Yep. So you'll want to talk with your dedicated account manager or sales rep, depending on the market that your customer is in, for the right network to quote for this product.
Okay, there's two more questions. The first one is, what size groups can participate?
So this product is designed for any employer that is traditionally self-funded, so not on our level funded chassis easy funding. Our belief is employers should be sophisticated and understand that there can be some level of noise that is larger than a traditional PPO network. So it's really based on you, the consultant, working with our team to determine if an employer is a right fit for this product.
And the next question, they still keep coming in,
That's
is
great.
are we still able to work with other stop loss carriers if this is in place?
Yeah, so we would want to work with our underwriting team to make sure that other carriers understand the product and also agree to things like reimbursing in the event that a claim needs to be settled outside of the run-out period of the stop loss treaty.
Great. Is there a PEPM cost, or is it a percentage of savings?
Yes, so this product, you'll pay your normal HealthEZ administration fees, and then any claims that run through the market-based rate of reimbursement will incur a 30% of savings fee. Now, that 30% of savings fee is calculated off of the difference between the network rate and what the market-based pricing rate is. So we're only being compensated when we actually deliver real savings below the network rate of reimbursement.
There aren't any more questions, but if you want to give just 10 seconds, see if anybody types anything in response to your question, your answers. Okay, doesn't look like there's any other questions coming in, Josh.
Great. So if you have any July 1st renewals with HealthEZ or July 1st new business that you're looking to place, those are the first effective dates that we will have groups live with the precision pricing product.
Thank you, Josh.
All righty. Thanks, everybody.